Hi everybody, welcome to Beauty Buzz with Lori. We have here today Allie. She is our patient care coordinator here at Garcia Facial Plastic Surgery, and she has kindly agreed to allow me to professionally dermaplane one side of the face and do a home kit on the other side of the face. So if you didn't get to see the past video, you can go on YouTube with regard to the differences between professional dermaplaning and home kit dermaplaning. So today is our follow-up video so that Allie can give us her opinion on which one she thinks is better or which one she likes best. So basically I've already double cleansed her, and I've already, I'm going to actually do the professional dermaplaning on the right side of the face. So I've already wiped it down with the alcohol. So with professional dermaplaning, we want the skin to be dry so that the blade doesn't skip over the skin, because I'm going to be using a scalpel with a 10 blade on it in order to do her dermaplaning. So we're going to go ahead and get started. So Allie, you've been dermaplaning with me for a while. One of the questions I get asked a lot is, does dermaplaning hurt?
It does not. Dermaplaning is actually kind of relaxing, and you don't feel the blade. It just glides right across your skin, and there's no pain involved with this procedure at all.
And so I always make sure that my patients know that there are just a couple of rules. You know, first and foremost, we want to keep you safe. And so I want to make sure that if Allie has to cough or sneeze or has an itch on her face, that instead of doing those things and or just sticking a hand up to make sure that she's scratching, I want to make sure that I'm pulling the blade away. So I just ask you to put one hand up, and then that alerts me right away that I need to pull the blade away, and then that keeps both of us safe. This is one of my favorite treatments to do too. I probably say that about all my treatments, because I really do love all of our treatments that we do because they're so effective. Some are instant gratification, some are not. This is one of those instant gratifications. It's one of those things where you don't notice the vellus hair on the face, but whenever it's gone, you notice, because it just gives you this beautiful glow to the skin. Your makeup goes on amazingly. So with that said, I'll just reiterate that this procedure is not to remove vellus hair. That's not what we do dermaplaning for. We do dermaplaning so that we get a nice, good exfoliation of the dead skin cells, so that product can penetrate easier, so that your makeup glides on well. It's a great starter or add-on for other procedures, such as chemical peels, hydrofacial. I've even done it prior to doing microneedling before. And so that's what it's for, is to remove dead skin cells. One of the side effects of dermaplaning is the removal of the vellus hair. Vellus hair is just the technical term for that peach fuzz that you see coming up. And then of course a lot of people can't stop touching their skin afterwards because it feels like a baby's bottom, literally.
I'm guilty of that. After doing the dermaplaning treatment, I always find myself looking in the mirror, wanting to just touch my face.
I know, I'm guilty of the same thing.
I feel that it leaves my skin looking very refreshed.
It does, I agree. So you can see right there, Heidi, if you can kind of zoom in, that's a mixture of the vellus hair and the dead skin cells that you can see in there as well. So it has been a little bit since Allie's been able to get on my schedule, so she's very happy to be here today. Normally I make Allie make all these funny little faces. I'm trying not to make her do that on camera, so I'm trying to work around all of her curves. Okay. All right. right, the professional dermaplaning is done. So now I'm gonna read to you the instructions. All right, so we've thoroughly cleansed the face. The face is dry, and so now it says to apply a thin layer of sweet almond, apricot, or jojoba oil to allow the blade to glide easier onto the skin with less irritation. So that's a difference right there. So we need the professional side nice and dry so the blade doesn't skip. And with this one, they're wanting us to put a thin layer of oil on there. So I didn't have any of the listed oils, so I did have some coconut oil, which is safe to put on the skin. So I'm just gonna emulsify some of that in my hands. Alrighty. So instead, just a thin layer, so we're not wanting to put, you know, a ton of it. We don't want oil slick on her face. Okay, kind of feel like I need to switch out gloves for some reason, so I'm just gonna do that. Okay, so we've got the oil on. And so this is the little container. It comes with 3 blades, this particular one does. So we're just gonna use one today. Alrighty, so we've got our oil applied. Okay, wet the blade in warm water and then start with downward strokes. So again, another difference in this. It's kind of weird doing this as a professional because it's doing everything that we're not supposed to do with the professional. And I purposefully didn't like pre-look at all of this stuff so that I could be reading it to you. So I wanted this to be as real and transparent as possible. Alrighty, so we're gonna start shaving with the hair growth in downward strokes at a 45-degree angle. That's normal. Okay, it doesn't say to keep wetting it, it just says to run it under water. So, all right, Allie, let's see how this works. So I'm just gonna start on the cheek. So far, how's that feeling?
I can hear this one more than I could with the surgical.
Okay.
As far as how it feels, wet. And it seems to not be gliding as smooth as
the professional
scalpel.
So you can kind of see that on there. Yeah, I have to say it's just as weird for me as it is for you. I felt like I needed to wipe my blade off, so that's why I ran it underwater again. I'm not feeling like I can be quite as precise with this. And it almost feels like, from my standpoint, it feels kind of like I'm scratching her face.
I was gonna say, I feel as if it's maybe just taking the hair?
Just the hair off, yeah.
And not so much the dead
skin cells, sure. Yeah, I feel like this is a bona fide shaving as opposed to the dead skin removal process. Yeah, you can see the hairs. Can you get in there?
I almost feel as if the oil is also possibly, and I can't see it, clogging the blade a little bit, causing you to maybe have to wipe it off every so often.
Yeah, it's
but I could be wrong.
It's just different.
Because you can feel it at first start to scratch, and then it goes a little dull.
Okay. Yeah, it almost, does it feel like it's pulling at all? Because I can almost feel like a little bit of a pulling sensation. Okay. Yeah, and I'm going to say my verdict on this already is I'm not a fan. And, you know, I'm not going to lie, I'm a little biased because I do the professional and I know what it's capable of. And as far as what I can see from one side to the other, this looks like we're just getting a blunt cut, which you would, you know, we're getting really on both sides, but this, I guess, just feels like more of a smooth treatment. All right, and so then on the instructions, it does say to just gently wipe the face where we've done the dermaplaning. And this is just really, it looks like, to get any of the hair off. Now for the real test. So Allie, feel the professional side first and tell me what you feel.
Feels amazing. Very soft.
She's already so excited.
I know. It feels very soft.
Okay. And then now touch the home kit.
I still feel a little bit of the vellus hair.
Uh-huh.
To be honest, my left side of my face feels a little irritated.
Okay.
As I mentioned, I felt that it was scratching a little bit.
Mm-hmm.
So it does feel a little irritated, whereas the right side does not.
Okay. Okay. And just to be, again, completely transparent, some people, depending upon their skin, can have a little bit of irritation from a professional dermaplaning as well. But again, Allie's been getting it done for a while. She doesn't have sensitive skin to begin with, so for her dermaplaning does not cause any irritation whatsoever. It's a treatment that she can have done and go back to whatever she's doing. Without any, you know, additional redness or anything. But I mean, even I can, you know, you can even see there's a little bit of redness just on her cheek right here, a little bit of pink. And there's a little bit of pink on here. So this maybe is where she's, you know, getting more irritated or whatever, but this feels sensitive, or this doesn't feel sensitive and this does feel sensitive.
Yes.
Is that what you're saying?
That's correct.
Okay. So yeah, I think that, you know, at-home dermaplaning, I'm sure, you know, it has its place, but if you want a true dermaplaning, I think that a professional dermaplaning, you should at least try it one time and then you decide for yourself. But as far as us here at Garcia Facial Plastic Surgery, nothing beats a professional dermaplaning. Thanks for watching.